Well, February is National Cancer Prevention Month. I'm here in Studio 61 with Hartford HealthCare's Cancer Institute Medical Director, Dr. Andrew Salner. It's great to have you back. We always appreciate when you can come here. Now, we hear so much about early detection and, more importantly, prevention that can make such a difference. What does that look like for the average person?
Well, we think that of the 2 million cancers that will be diagnosed, cases that will be diagnosed in the United States this year, 24,000 here in Connecticut, that roughly 1/3 could be prevented if people could follow all of these prevention steps. So the top 10 prevention steps, if you will, first includes tobacco. Tobacco, the largest cause of preventable disease and death related to cancer. Stop tobacco use. There are cessation programs that are available, and it is the biggest cause.
A huge difference, yeah.
Second, avoid secondhand smoke. Secondhand smoke is also a cause of cancer. Don't let people smoke in your home, and don't let people smoke in your car.
Right.
Just don't go there.
Yeah, and it's heartbreaking when you hear about somebody who has lung cancer or something like that and never smoked a day in their life.
Right, and about 15% of lung cancers occur in non-smokers. The third one is sun exposure. Please put sunscreen on and minimize your unprotected sun exposure. Sun exposure causes skin cancers, some of which are pretty lethal, melanoma, for example.
Yeah.
So use sunscreen, use sun-opaque clothing if you're sensitive to the sun. And the fourth one is related, don't go to a tanning salon.
Yeah.
We now know that ultraviolet rays from tanning salons also cause skin cancer, and we've seen a rash of skin cancer in young people related to a tanning booth use, so please don't use tanning booth.
Yeah, there was sort of that rumor back 10, 15 years ago that it was a little bit healthier as far as like a healthier suntan.
Right, it conditions your skin to sun, but it doesn't. Yeah. The fifth one is exercise. It turns out that exercise is protective against cancer, and it's also protective against a cancer recurrence for people who've gone through a cancer journey. And we should all exercise 150 minutes a week minimum, with exercise 5 days a week. That means 30 minutes a day of a brisk walk. We could all find 30 minutes a day if it's going to really improve our health. And exercise also helps protect us against other problems like cardiovascular issues. So exercise is important. Number 6, live lean. Try to have an optimal body weight if possible.
Yeah, watch your diet and I guess your intake.
Don't let perfect be the enemy of the good. Any weight loss if you're overweight is helpful. And decrease your sugary beverages, decrease carbohydrates and processed foods, and we should all have 5 helpings of fruits and vegetables a day. And that eating healthy and exercise will help us live lean.
So let's talk about what else we should and should not put into our body, because there's alcohol.
Alcohol is increasingly now a known risk for cancer. And we're not suggesting that everybody completely omit it, but we're suggesting that people try to minimize it.
Yeah.
Viruses, hepatitis, HPV, and AIDS virus all increase risk of cancer. And a couple of those we have vaccines for. HPV originally was aimed just at preteens, but we've now learned that people up to 45 could still benefit from getting an HPV vaccine if they haven't received it already. So HPV vaccine helps to prevent pharynx and cervical cancer, and a hepatitis B virus helps to prevent hepatitis. The next one is carcinogens. We know that some people work in an environment where they're exposed, and they should talk to their environmental health expert in their company about how they could decrease their risk. And for people who live in an environment where they think that they might be being exposed to carcinogens, they should go to their public health department and talk about what they might do to help decrease their risk.
And the last one is screenings. Make sure you get those in.
Screening is big.
Yeah.
Because we now know.
Would you say that's the most important? If you had to.
I would say that's the one that we can easily get our arms around and doesn't involve necessarily a lifestyle change, so perhaps it's the most doable. Get it done. All of us should get screened for colon cancer starting at age 45. Colonoscopy, the most effective way of doing that, but there are other techniques as well. That has been moved down from 50 to 45 because of early onset cancers that we're now seeing. And my guess is in the future it might even become an earlier age. Only has to be done every 10 years if you're at average risk.
Right.
Women should have a breast cancer screening done. We recommend mammograms starting at age 40. People at higher risk maybe earlier. Cervical cancer screening by your doctor you should discuss. And anybody who is a current smoker or who is a former smoker within the last 15 years should get lung cancer screening. It's a simple 1-minute test.
Oh, so why not do it?
With a low-dose CAT scan that detects lung cancers at stage 1 that can be much more easily cured.
So important to get those screenings and make some small tweaks, right?
Exactly right.
All right, Dr. Salner, thanks so much. Appreciate it.
Thanks, Erica.
Really important information that we all need to keep in mind as we
My
go through our
pleasure.
days. Yeah.
Thanks.